Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Terry Ciesla. He's SVP at ScribeEMR. Welcome, Terry.
Hey, John. Thank you for having me. Very much looking forward to this.
Yeah, this is part of our ongoing series, kind of featuring all the various AI medical scribe, ambient clinical voice companies out there. So excited to have you here. But for those that don't know you, tell us a little bit about yourself and ScribeEMR.
Yeah, sure. So I've been in healthcare for 30 plus years. Actually started in the Navy on operational medicine. So I've got a really nice clinical background, but I was able to, first of all, I'm a geek by nature, or I could get very
Nice.
geeky. And so I was able to really kind of put, my ambulatory operations together with my computer background, and really got into the clinical documentation pieces around the turn of the century, where I worked with speech recognition, and then eventually with natural language processing, which is now, as we know it, is the whole AI environment. So probably on the AI side, I'm at about probably the 15-year mark.
Wow. I mean, that's quite the evolution of, from clinical. It's nice. I mean, that's how a lot of the IT, experts have come is they had to come from the clinical because there were no degrees in IT or different things over the years. So that's
Mhm.
interesting. So tell us, what's the story behind ScribeEMR?
So ScribeEMR, actually owned by a fellow named Anirudh Baheti, and Anirudh, he had his first company. It was called Focus MT, and he started that one in 1999. He held that for the better part of 10 years. So this is right at the start of speech recognition. So he held that piece for about 10 years and ended up selling that to Nuance, which is now, of course, Microsoft, all the Dragon folks.
Yep.
But about 6 years after that, a lot of his former customers were asking, if they're going to get involved in the scribing space, because he did a really good job in transcription. He was a competitor of mine, took
Mhm.
a really large customer from me once. But anyways, he did some due diligence in 2017 for about 6 months, and then figured out, yeah, he could probably start something that and do very well in the scribe space. So he incorporated in 2018, and around 2022 we started really developing the AI module. And one of the advantages that we have is over 1,000 physicians are using our remote scribes day to day in a live environment. So we sought permission from our customers to start to de-identify those recordings and then store them. And so the long and short of it is we combined or wove together some different technologies, and then really leveraged all of those recordings in 40 different specialties, where then the output of our AI charting application is really probably the top one, number two, somewhere in there.
Yeah, I mean it's great. I've heard that from a number of those in the space that the hardest thing is getting the audio from visits to be able to train the AI. So that's
Yeah.
interesting that you had that available. So talk to me, how does this your solution compare to all the other AI medical scribes out there? This is where I give a little plug for Healthcare IT Today. Go check out our list on Healthcare IT Today, right sidebar, click Ambient Clinical Voice, AI medical scribes, you'll see the list. But how does it compare to, all of those? It's the biggest, most exciting thing in healthcare, I think, right now. But how does your solution compare to them?
John, it's really boils down to accuracy. And so what I'm seeing of late is our accuracy is at or near 100% every time. And I was at the Physician Health and Wellbeing Conference this week in Hilton Head, and I was speaking to a dermatologist, and he was telling me about his workflow. And going back to my clinical background, I did about 6 years in dermatology specifically. And
Wow.
so I said, well, let's put this to the test. Let's you and I do a visit right now. And I said, let's not just do a sinusitis or a little acne. Let's dig in. So we did an encounter, and the patient ended up having leishmaniasis.
Mm.
Now, leishmaniasis is primarily it's from gnats and sand fleas over in Eastern Africa. And in order to really put a definitive diagnosis on leishmaniasis, you have to do a right Giemsa stain. So Ryte Giemsa. Giemsa is Giemsa. And so the long and short of it is, the patient had fever. He had these lesions, which were ulcerated in the middle, erythematous borders, scaling. And so we ended up, doing this, he ended up submitting a gram stain, or not the gram stain, but the Ryte Giemsa stain. And the results came back positive for leishmaniasis. And so then there's a medication that you have to prescribe. So in saying all of this, um, it's not just a typical sinusitis, or a well patient visit or something like that. This was this was really out of the ordinary, that would have challenged any neural network of any of my competitors, and I don't know that any of them would have come out with a chart that looked like ours. And not only, John, did it diagnose it, I mean, put the diagnosis in correctly, and the prescription, I can't think of the name of it. It's a longer kind of an antiviral antibiotic kind of preparation. But anyways, it also coded it. So it gave the perfect ICD-10 for leishmaniasis. It gave them an ENM level of 4, which I told the doctor we can probably work it to a 5. And so, again, accuracy and the ability to really stretch it to the limit. And leishmaniasis is a stretch.
That's interesting. It's funny because I've actually done the same thing, and I use mastocytosis, which is a dermatology thing that my son had. That's pretty rare, and then so it's funny you use the same kind of thing, to test it. That's
Yeah.
great. So walk us through, what does the workflow look like for a clinician? Do they use their cell phone? Do they use a desktop? Walk us through the workflow for the clinician that's using ScribeEMR.
Yeah, sure. Mobile solution. So we're going to want to use a laptop, iPad, MacBook, Chromebook, something along those lines. My orthopods, they always tend to really love to use their phones. I steer them clear of phones unless they're really wanting to use a phone. But I always tell them, look, it's not if you get a phone call during the clinic, but when. And when you get a phone call, that interrupts everything. The phone call takes precedent over anything that you're doing. But anyways, yeah. So we have the iOS and the smartphone applications, but most of them are just using iPad minis.
Hmm, interesting. Yeah, I mean it's interesting, but you can do it on a desktop, a laptop as well.
Absolutely, yeah. It's a web-based, simple URL, username, password.
Interesting. And is the workflow walk in the room, hit record, get patient consent, and then the notes generated, or walk us through kind of what that workflow looks like?
Yeah, so ideally we would want a scheduling feed into our application, which is called ScribeRyte AI. So we'd want that scheduling feed, and then once the doctor opens up the ScribeRyte either on the phone or desktop or whatever, the schedule presents for the day. They click on John at 8:15, and then it just goes right into record, and they just start seeing their patient. And I mean, it just from that point on, it's just capturing the ambient pieces, as we call it. And I've really tested this myself in just starting. I'm a Buffalo Bills fan, right? So I may ask a question about football or Bills or whatever, like to really take the application off mark, and it does not put any of that stuff in. Although I did see one recently where the patient had pinworms of all things, and they needed to really put a definitive diagnosis, so they had to do some testing for that. But the patient was going to New York City like in 2 days, and so the doctor said, that the patient was going to New York City, and if this comes back, that she'll send the prescription to the Walgreens in New York City. And I thought, I wonder if it's going to pick all that up. Perfectly picked it up. So
Wow. Interesting. Well, I mean, the technology's come a long way to automate that note, so that's awesome. Talk
yeah.
to us. I mean, it's interesting you have a background in scribes. So how much of this is automated with technology? Are there humans in the background? How are you kind of approaching the technology versus human aspects of this?
Yeah, so nobody behind the curtain, like the other folks that are out there. This is 100% based AI. We do have a scribe component in that, what we call ScribeRyte Plus, where if I get I have some busy orthopods in Mississippi, and they're seeing 70 patients a day. And if you've ever worked with orthopedics, they don't want to be bothered with looking at things and stopping signing. So what they do is once they're done with that patient, they just hit submit and it gets routed to a transcriptionist. And then our service level agreement is within 1 hour, it's into their EMR, which is called Modernizing Medicine.
Wow. And so they're reviewing the essentially the ScribeRyte note that was generated and kind of
Right.
adding a human check on the AI
That's
generated
it.
note.
And they have the audio file so they can listen to all the key points, make sure that everything's in there correctly. And then if they make any changes, of course, there's this whole machine learning that takes place in the background. So either the physician is gonna, make any edits or the scribe and then pushes back in, for the machine learning.
For learning. Awesome. And you talk about the EHR integration. How is it integrated with EHR? Is it working with all EHRs? You mentioned modernizing medicine. Yeah, I know it well. Does it integrate deeply, to the granular data elements in modernizing medicine? Or yeah, anyway, talk to us about your EHR integration
Yeah.
and approach to that.
So first of all, we did complete an agreement last week with Epic. And so right now in Epic, there are two different AI applications within, and that's DAX from Nuance Microsoft, and then Abridge. And we're now the third that's going to be put in there. So it's probably a 6 to 8 week project. So that's a tight integration. So when you go into Epic, you double click on ScribeRyte AI icon, and it opens up within Epic. For any of the other EMRs, it really depends on how they're set up. We're using Fire APIs, which is kind of the industry standard now. Right now, if we're not using Fire, we're using just that standard HL7 messaging. And so, we certainly like to bring in the schedules from any of the EMRs. That's usually a pretty simple thing. We're working with one EMR right now that wants to send us a CSV file, and that's from the 90s. So they need to step it up a little bit. But yeah, and then once we have the schedule, the doctor goes through the whole clinic and submits the note. It'll go back into the EMR, and then it's dependent on the EMR. So we have something called section analysis, where it can tell, okay, this is the subjective piece of the SOAP note, or this is the review of systems. It tells it via section analysis that it needs to go into this certain section or module within the different EMRs like eClinicalWorks and such. If we can't do that, then we've got to send that whole like a PDF back in.
Gotcha. Yeah, that's great that you're working with Epic and able
Yeah,
to go there. There are a number of others that are as well, but the two that were on stage were for sure Dax and Abridge and have the higher level. That they're it's interesting. Epic's going. They've said they're trying to integrate with everyone that is
yeah,
available. So we'll see how that evolves over time. But that's great that you've made progress there.
yeah.
Um, let's talk about the clinician. What do they have to change the way that they're talking in the exam room? What's your onboarding strategy for clinicians? How do you get them started and kind of trained up on what it is? The obvious ones we've done over the series is they have to say things that they're thinking, and they have to say things that they're seeing. They can't just obviously we don't have the brain interface yet. We'll see if someone comes
Yeah.
up with that eventually. Any other things that you work with your clinician to onboard them and things that they need to change to make it more successful?
Yeah, funny you should say that because I do always like to say that, the next step in this whole thing is just to think it and it appears. You know.
Hey, I
Uh,
mean, they're working on it. I was on stage at Human X with the brain interface person, but there's still a lot of work to be done there.
yeah, I would imagine so. Yeah, so our implementation outside of interfacing or any kind of integration is generally going to be about 10 business days. What we're doing there is we set each of the providers up with Zoom. And so we asked to record about 50 of their encounters. And so we just let them go with that. We take the encounters, we feed them into ScribeRyte AI. And so that begins that little bit of a training module. We have a speech draft group that monitors, the quality. And so we don't let the docs go live until they hit 9 out of 10, or at least a 90 percentile rating. And then from there, we just let them go. It's so intuitive that the dermatologist I was talking to. I said, "Look, Ozzy, I can give you a username and password and not even tell you how this works. and you'll figure it out in under 5 minutes. So it's just a click, click, and it's just so rudimentary. It's so logical.
Yeah.
Um, but yeah, and so then, in terms of the changes in their what they've got to provide to the application is really, I don't, nothing comes to mind more than what you just said is that, I tell them, look, it doesn't understand that so you have pain right here. So you have pain in the left elbow area, so kind of laterally, right? Yes, yes, doctor. So you just have to describe what you're seeing instead of just thinking it and charting it yourself. And this, but the same goes with our remote scribes. So we don't turn the video on. Even in orthopedics or dermatology, you'd want to see that laterality. We don't turn it on. So we've got, thousands some scribes that are working every day, and all they're doing is listening to the audio. And so the physicians, the behavior modification is very quick. And if needed, the scribe will give them a little nudge and say, Doctor, what was it, left arm or right arm? And so I don't think there's much to it. Once they see what the notes are and they're thinking, oh yeah, I, I do have to say left eye or under the left eye or ethmoid sinuses.
Mhm.
Um, but there's not a whole lot. And so far, all of the docs that I've put on, I just absolutely love it.
Yeah. Well, that's fascinating that you actually do like recordings of their visits to personalize it in that way. That's a pretty unique approach that I hadn't really heard so much before. There's certainly personalization that's happening across it, but I love that you're doing the kind of Zoom recordings to personalize it. That's really
Yeah.
interesting. So talk to me more about accuracy. You kind of mentioned it a little bit, but how accurate is the solution? How do you measure accuracy? How do you kind of approach and evaluate how accurate your node is?
Oh my gosh. Now we need the data scientists on. I do have data
Sure.
scientists, obviously, on staff, in addition to the 16 engineers. But there's a whole rubric that we follow, and um, pretty much it runs off of corrections that are made by providers, and so we're constantly monitoring that. Um, but yeah, all in all, it's in the upper 90s consistently. And as I said, even just fresh out of the box, talking about that dermatology disease that you and I were discussing. It's probably heard my voice 6, 7 times maybe, and the doctor on the other side never heard his voice. And 100%, it was absolutely 100%.
Yeah. It's amazing. It's come a long way. So talk to me about the specialty approach. Does the product work for every specialty? Are there certain specialties you're kind of focused on? Or, it's interesting you have such a background in scribes across 40 specialties to train the data, I think you said.
Yeah.
But yeah, talk to us about, does it work for every specialty? Are there certain ones you're focusing on?
Yeah. So I think just by luck of the draw, it seems to be orthopedics. Those men and women really seem to love the application. I've got folks seeing 70 patients a day in the orthopedic space, and giving them the application did not detract from that volume at all, or their workflow. We've got some activities now in dermatology. We've got family medicine. One of the newer ones is a workers' comp group up in New York. So that's like completely different. So the one thing about workers' comp is there can always be litigation. So your document, and I've been told this by a lot of physicians that do this, the document has to be perfect. It almost has to be done for a doctor, but written by a lawyer. And it's just, the ScribeRyte AI application is just, it's just a blazing inside this little group of providers that are, specialized in the workers' comp arena because it's subjective. It doesn't think, it just gives. And what comes out is exactly what, occurred during that encounter. So no, did I say subjectivity or objectivity? Objectivity.
Yeah.
Anyways,
Well, I think it's interesting because that's one of the beauties of these solutions. The AI medical scribe captures everything.
yeah,
It's comprehensive.
and it
Humans can
does.
miss
Yeah,
stuff in their head or, when they're documenting later,
yeah,
forget something that, I heard one AI medical scribe company say, "Hey, we need to reduce the documentation because it's so much of a burden on the clinicians to sort through everything. That's the good and the bad of the EHR. You have everything, but it's overwhelming how much it has." And I was like, "Well, the AI scribe's going to make that worse."
Well, and given that though, it's machine learning. And so, it's if it's giving you too much documentation and you consistently are removing the pieces that you think, I don't need that, I don't need that, machine learning will take over, 3, 4, 5 encounters. It'll pick it up and say, okay, well, this particular doctor doesn't need that. Or, my team can actually go in and reconfigure and change some of the configurations so that it doesn't pick all that stuff up. And, each doctor has their own customized templates. And so, it's just not like some of the other folks that you just download. This is, you get what you get. We configure or customize templates for each of the physicians.
Yeah, absolutely. Well, and the next AI is going to summarize all of your 17 visits to the doctor soon, anyways. In fact, some people are already doing it, including Epic and others. ECW, a lot of them are doing that. Well, whenever we do these, I think the number one question we get is where can people go to learn more? Where can they get a demo? Where can people go to find out more about ScribeEMR?
Yeah, sure. So www.scribeemr.com, and you'll see ScribeRyte as one of the headers. We are definitely not just a an AI company. We do provide remote scribing. We provide virtual medical office services, which prior authorizations. We have folks answering the phones, making appointments, all those things. And that kind of grew up out of COVID. And one of my customers just called me and said, Terry, you guys are awesome with the scribing service, and do you think you can help us with insurance eligibility verification? I said, well, of course. I have that ambulatory care background. So I
Yeah.
said, well, sure, we could. And that grew into like 100 and some people now, since COVID, because there's a lot of challenges with staffing.
Yeah, absolutely. Well, Terry, I appreciate you taking time to talk with us and share about ScribeEMR and your solution. I'm sure people will want to check it out and give it a run and put it through its paces. So thanks so much for taking time to talk with us, and thanks everyone for watching and listening. If you want to
Uh,
find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Terry.
all right. Thanks for having me, John. I appreciate it.